Rural hospitals are struggling throughout the country, and the number changes routinely, but somewhere between 190 to 205 have closed in the last 10 years. They certainly did not want to be on that list.
I was aware of the financial situation with Mayo Hospital and that they had had several years of negative operating margins and things like that. And I just wanted to see the hospital continue in the community because it's one of the great things about this community.
For the long-term success of the organization, standing alone as a rural healthcare provider was not going to be the best option. We took stock of the relationship that we already had with Eastern Maine Medical Center and Northern Light Health. We had been a part of working with them clinically for 25 years, and we just saw that they were large enough to have the resources to bring to the table to help Mayo out of its current hole and help us to reach success into the future. So Mayo Regional became part of Northern Light Health on Sunday, March 1st. I was appointed president of Northern Light C.A. Dean Hospital on Monday, March 2nd. Incident Command was stood up that first week of March, and I remember distinctly a special Leadership Council meeting on March 15th to discuss ramping up and what our response to the coronavirus pandemic was going to be.
Being the newest member of Northern Light, they were really helpful and instrumental in helping support us through this change with the pandemic.
They said, basically we're looking to order some tents, and because we're going to be setting up some triage tents and things like that at different facilities. What are you looking for? What would you like? The system helped to push looking at that and helping us to get things set up the way that they are right now.
As a leader, there's a lot of long hours and communication back and forth throughout the system. I've been traveling down to Bangor. We went down to visit the Bass Park, set up down there to kind of get ideas on how we can improve our setups here. We really collaborated and tried to make the best and smoothest process possible for our patients, our community.
When we merged, we knew there were going to be vast resources at the system, but to be a part of the response with the Unified Command and the Incident Command at the system, virtually every layer of my organization has some level of support from the system in their response to this. My department leaders, not prompted by me, kept coming on the line saying, I don't know what I would have done without Northern Light during this time.
With the virus, we have 2 ventilators here in-house, and getting supplies for those was a struggle because they were being requested nationwide. So a lot of the stuff we ordered was back ordered until October. I was able to reach out to some people down to Northern Light Eastern Maine Medical Center and had the supplies that I needed within the matter of a couple of days. So I don't even dare to think what we would have been up against had we not been able to reach out to them as a resource.
I think that's the biggest piece that we've kind of taken away from the pandemic was the fact that we have support out there, we have resources, and that we have member orgs that are willing to help us through this. And I think in times like this, we have to kind of rely on each other and lean on each other for that support.
We would not have been able to make it on our own without any other type of backing. It clearly helped us immensely to be able to withstand this time, and our employees are still here. Our employees are working. There haven't been any layoffs. All things that I know for a fact I would have had to do in order to survive on my own.
I'm very happy to be part of this organization here at Northern Light Mayo, and looking forward to many years of growth.
Now that the merger has taken place, I see that things are heading in a positive direction and just hope that they continue to head in that direction.